as well. Oh, it's recording in progress. I'm looking forward today to going over working as a peer specialist in rural Idaho and managing ethics in rural communities. The topics I'm going to go over are, I'm going to go over a little bit over my experience as a peer support. And then when I speak about peer support within this, it's the blanket statement. It's for youth support, it's for family support, it's for people that are in recovery. I'm just going to say peer support, but it means for anybody that's working in this field. I'm going to go over the overall codes of ethics and personal conducts. I'm going to kind of read through them and how they apply to us, give some examples. And I'm going to go over the cause and effect of limited resources in rural areas. So out in areas, there are limited resources. It's not like being in the big city where they have a lot of funds and they can have a lot of resources. It's quite limited. And then the ethical challenges. What's it like to work out in the communities with in a rural community, and then best practices for peer supports. We do have the chat going on, so along the way, if you have a question and you want to ask, please put it on there. I'll address them as they go. All right. Let's see. So just a little bit about myself. My name is Daniela Munden, but I do go by Danny. I'm a veteran. I identify as queer. I'm married. I'm a stepmom. I just became a grandmother because I became a stepmom. I grew up in Europe. I'm an illustrator. I am a world traveler. I live as a minimalist, and my dog is Jack. I currently work as an outpatient department manager for a body and mind health services. So I manage not only just peer supports, but also case managers and CBRS providers and targeted care coordinators. I also train staff, and I also train peer supports on ethics, and I train them on best practices and how to provide the best services. And then I, as a peer support, use my experiences as being a veteran in the military, as being queer. I share my experiences dealing with PTSD with other people, and a lot of times I'm an open book. So I love peer support. It is one of the best professions. I have a degree, and to me, peer support is the best thing that's out there. All right, so here we go. So we're going to go over the overview of the Code of Ethics and Personal Conduct. And professional conduct, not personal. So there is currently 16 codes of ethics and professional conduct rules that we have to maintain. And so the first one is our job is to role model. Our job is to role model what it's like to communicate effectively. Our job is to role model recovery. What's it like to practice good self-care? What's it like to reach out for help and learn how to ask for help when help is needed? Number two, we respect the rights and dignities of those they serve. So everyone's unique. Everyone in this world has a different perspective. Everyone lives their lives a little differently. It's not for us to judge. We meet our clients or peers where they're at, and some of them might have different backgrounds. They might have different stories, different beliefs than us, and it's okay. Our job is still to respect them and to provide them dignity. We always respect privacy and confidentiality. You guys want your privacy protected. It's especially when you're working in a rural community, a lot of people know each other. And so, protect your privacy, protect their privacy. And I'm going to get more into this a little later on the best practices for peer supports. We openly share their personal recovery stories with colleagues and those they serve. So in my experience, I am open to sharing with clients, but I don't always share a lot. I have found that clients just want enough to know that you connect with them, and it's not about me. So I try not to overshare, but I share just enough that they know that I'm in recovery and that I'm living a good life and that they have a good connection with me. Going to maintain high standards of personal conduct and conduct themselves in a manner that fosters their own recovery. So once again, this is part of role modeling, making sure that you're seeking out help and you just continue to role model. I think that one's pretty simple. All right, so then number 6 is never intimidate, threaten, or harass those they serve. Never use undue influence, physical force, or verbal abuse with those they serve, and never make unwarranted promises of benefits to those they serve. You would be surprised that this one does quite happen a lot. And so we always need to keep ourselves in check. We're working with human beings that we decided as when we became peer supports that we wanted to pay it forward. And so we got to look at the people that we work with, and you might not agree with the lifestyle or the choices they're making, but we don't need to threaten them. We don't need to intimidate them. We don't need to harass them. If you notice that you are working with coworkers, or if you see other people doing that, please reach out to your supervisor. Please report them. That way you can get the client the best support they can get. Number 7 is do not practice, condone, facilitate, or collaborate with any form of discrimination on the basis of ethnicity, race, gender, sexual orientation, age, religion, national origin, marital status, political belief, and or mental or physical disability. This one comes really to light when you're working out in the rural community. A lot of people in the rural community, the reason they're in the rural community is because they have similar beliefs. There's a social order, a social standard that goes there. And if you're coming in from the outside, you might not understand. And so me specifically, I identify as queer. So when I work out in the rural communities, I kind of keep that in check. I don't make it about me. And I learn from my clients, and I find out what their beliefs are. I find out what the social standards are. I not only just get to know them so that I can work with them, but I also kind of want to get to know the feel of the area, because when I'm done working, I'm going to go home, but these people still have to live where they're living, and they're still going to have to manage their daily lives. Okay. Number 8, never engage in sexual or intimate activities with colleagues or those they serve. This one happens quite often. It's not good. So a lot of times when we are working with people, depending on where they are in their own recovery, their boundaries are a little different. A lot of times we're teaching these people how to be good friends. We're teaching them how to communicate. We're teaching them how to set good boundaries. And sometimes when we start working with people, their admiration for you or working with you sometimes gets a little skewed. And so I have found a lot of times in my own work experience, I do have to set conversations about sexual behavior and intimacy. Appropriate texting. They can't text me stuff. In my own personal experience, I've had clients who wanted to have sexual relations, and I've had to end those. Like I either had to end the working relationship if I felt like it was unsafe or if they weren't going to listen to me, or I had to keep stern boundaries. And if I felt like they respected my boundaries, then we could continue working together. But that one's always, if you're ever stuck in this situation, or if you ever find yourself in this situation, please, if you're working for an agency, go to your supervisor, go to a licensed clinician and talk about it, and maybe see if you can continue to work with them, or if maybe they need to assign a new provider, because our job is to not cause more harm. Our jobs are to role model recovery, and for the people that we work with to, grow in their own recovery. Number 9 is don't accept gifts or significant value from those they serve. This one's also key. Working out in the rural communities, there's also refugees that work out in the rural community. A lot of times their way of, clients used to want to give me necklaces and want to give me jewelry, and I had to say no. If you're out driving and a client wants to go do something and you don't have the gas, they want to pay for your gas sometimes, you have to say no. We teach them boundaries. If they want to go do something and we need the gas, we teach them budgeting skills. We teach them how about we plan for the future, but never take a gift. And if it gets uncomfortable and you have a hard time saying no, let your supervisor know. Sometimes it might be that the client has strange boundaries and they're not listening to you. Maybe that working relationship needs to end. Or sometimes you just need your supervisor to give them a call and just to kind of go over what the guidelines are for not taking any gifts. Okay, we are on this one. All right. Number 10 is do not enter into dual relationships or commitments that conflict with the interests of those they serve. So because we're talking about rural communities, this one's a little different. In general, if you're in a larger community, when I'm working with clients, let's see, I'm here in Boise. So I'll say, hey, if I'm ever out in the community and I see you, let's say we go to an AA meeting or an NA meeting, I cannot come up to you. I want to protect your privacy, but you're more than welcome to come up to me, but I can't have friendships with you. I can't have you on my Facebook. I can't hang out with you. But rural communities are a little different because they are smaller, and a lot of people go to the church with each other. A lot of people go to the same school. A lot of people might work in the same area. So when you are a peer support in a rural area, you got to come up with some guidelines when you're working with people. Like when we go out to a group and there's a bunch of friends hanging out, you come up with, okay, so we can go and hang out, but we're not going to talk about personal stuff, but you can't come to my home, and I can't come to your home, and I can't hang out with you as a friend. Number 11 is do not abuse substances under any circumstances while they are employed as a certified peer specialist, support specialist. I think this one's a given, but you'll be surprised that this one does happen quite often where people do struggle with this. If you're working with some peers and you're noticing that they might be struggling in their own recovery, someone made a comment, I'm going to come right back to that. So if you are working, our jobs are to role model. And if you notice that a coworker is struggling with that, definitely please reach out to a supervisor if you feel uncomfortable talking to that person. Where our job is not to cause clients harm. And also we want to make sure that our coworkers and our peers, they're successful. And sometimes this does happen. And then Laura says, another option for not accepting gifts is to take a picture of the item and tell them that it will be in the of remembrance of them. That's an amazing idea. I have never thought about that, but that's really cool. Thank you. I'll start doing that one. 12, work to equalize the power differential that may occur in the peer support client relationship. All right, so this one took me a while to learn because when I became a peer specialist back in 2014, I didn't quite understand the power differential, but now that I've been working in this field for so long, I see it. So when people come and seek out help, a lot of times that's the first time that they've ever really reached out, and they're in a vulnerable state, and they're also at a state in their life that they want to get better. And so you're not necessarily seen as an equal. The person, if you are providing the services, you're seen as that person's hope. And so you have a little bit of power over them. It's not an equal working relationship. And I found that when I first started working with clients, it was clearly uneven. I was looked to for role modeling. If they were out in the community and they were having anxiety, my job was to role model for them. And then as time went on and they started getting more comfortable and started working more on their goals, the power differential went away. And by the time it came about equal, was generally the time that they graduated out of services. And so that's something you want to encourage. You want to be real with people. You want to remind them that you're a peer, you're there to support them, but you don't have any power over them. Number 13, ensure that all information and documentation provided is true and accurate to the best of your knowledge. So this one is key. When I'm training new providers in my agency, I always remind them that these are legal documents, that people are going to see these documents, that someone might be called to court, something might happen, a family member is going through a divorce, or family members want to, or the spouse or somebody wants to have access to information. You have to make sure that it's documented accurately, because you could someday be called to testify in front of court, or also it can come back and haunt you if you say that you worked with a client for 2 hours, but you didn't, and you make some stuff up. Eventually you would get caught. All right, so 14, we got keep current with emerging knowledge relevant to recovery and openly share this knowledge with their colleagues and those they serve. So here we have a team. I have a team of peer supports, and we're constantly updating them on the latest information. We're constantly updating them on where the current resources are. if someone's working out in a rural community or not a rural community, we let them know when the AA meetings are happening or when NA meetings are happening. Or we also provide continuing education. That's part of peer supports, is that we continue with our continuing education, and then we continue on with ethics. It is so much better if you stay up to date on current information. It makes you a stronger person. It makes your own recovery stronger. 15, remain aware of their skills and limitations, and do not provide services or represent themselves as experts in any areas for which they do not have significant knowledge or experience. So I have found that our roles as peer support is to encourage clients to reach out to the appropriate support they need. So if my client is feeling that they're feeling sick and they're not feeling well, I'm not a doctor. I'm not going to say, hey, it sounds like you have the flu. Maybe you need to go to the doctor. I'd be like, hey, maybe you need to get a hold of your doctor and make an appointment to see what's happening. Or if someone is experiencing crisis and stress, obviously I'm going to be there to help them, to share my recovery experience, to share what's worked with me in the past. But I'm not going to diagnose them. I'm not going to tell them what to do. I'm going to get them connected. I'm going to get them connected to a crisis center. Maybe they need additional resources, and I'm going to get them connected to a CBRS provider or a case manager. Or maybe they're not enrolled in counseling at all, and I can support them getting into counseling services. And then once they're in that service, if they continue to have crisis moments of stress and anxiety, my role is to role model how to manage that, and then also to reach out when needed, but not give advice that I don't know about. Like, it's not within my scope of practice. 16, do not hold a clinical role and do not offer primary treatment for mental health issues, prescribe medication, act as a legal representative, or provide legal advice, participate in the determination of competence, or provide counseling, therapy, social work, drug testing, or diagnosis of symptoms and disorders. And this is as simple as don't give Tylenol, don't give ibuprofen. Our role is just to encourage them to practice their recovery. If it's not in your scope of practice, you can say, I don't know the answer to this. Maybe we can go find this out together. Or how about we get a hold of somebody, or I can call my supervisor and I can find out what we need to do. Don't get yourself in a situation where if you say you're an expert or something, it never ends well. The client sometimes gets angry, they can get hurt, it can affect their own recovery. Does anybody have any questions along the way before we move to the next part? Has anybody experienced anything like this? If they want to put in the chat, go for it. All right. Cause and effect of limited resources in rural areas. So we're going to be discussing what are some of the issues of working out in a rural community? What are the barriers? So as I mentioned before, there are a lack of resources that exist and stigma that discourages people from getting help. Yes, here's the big issue, some limited resources. Exactly. They might not have, they might not have AA meetings or NA meetings in their community. Maybe somebody that you're working with they're at a point in their life where they're in need of recovery, and maybe they're needing to break away from their social community. Maybe they have a different faith. Maybe they have, maybe there's just something in their life that within their community is not socially acceptable, and they reached out for help, and there is no resources for them. You are the resource. You're the person there that's to help them. You're the one to get them to connected to the resources. And the beautiful thing is we have the internet, and a lot of times resources can be accessed online, but it still makes it harder. So there's higher rates of suicide, addiction, and substance abuse. So if there's a stigma for people to learn to ask for help, there is a higher risk for suicide. They feel stuck. They don't know where to go. If you find that someone is suicidal, or if you feel like they have an addiction problem, this is something that I've always done is there's a suicide hotline, 988. Sometimes people are afraid to call that number. So what I'll do is I'll call that number with them and I'll do the talking and be like, all you have to do is listen. I'm going to call this number and I get on the phone with the person and be like, hey, we're just calling you. We want to know what kind of services you offer. Can this person call anytime during the day? What can they expect? We have crisis centers. Rural communities might not have a crisis center, but for here, they can go to Caldwell or they can go to Boise if they have someone willing to take them there. I also call them and I find out, so what does it take to get into the crisis center? How are they going to be treated? What kind of documentation? Do they have to stay? Is it mandatory? Can they leave at any time? And I found that when I have done that, they are more apt to use that. They're more apt to call those resources. So Erica says it's also really hard to get out of the community that aren't beneficial to their recovery. That's true. So I would say search the internet, find something that is beneficial. There's always something. There's always a workaround. You just have to be creative sometimes. Number 3, rural residents are more likely to live in poverty, report poor health, lack health insurance, have a chronic health condition, and/or unemployment. I'm going to get back to that one. I'm going to read a question here. How do you navigate a situation where parents or guardians may not believe or want their youth in mental health or other treatment services? How would I navigate that? I empower the youth that I'm working with, and it depends on the youth's age. So obviously, if someone's not a teenager, they're a young child, I just work with them to, I work with clients to learn how to advocate for themselves. And so let's say we have a session. We talk about, say, I'm going to go meet with your parents now. The session's over. What are you comfortable with me talking about? What would you like me to share? And I empower them to have kind of control over how their appointments went. When they're teenagers, same thing. I used to work with a client whose father didn't agree with the services, and anytime that her son went to she was divorced, and anytime that her son went to counseling and the ex-husband didn't agree with the services, if he didn't say everything that was in the counseling session, he would get a spanking. And so this is where we would talk about, so what are you comfortable with us sharing? What are you not comfortable with sharing? And sometimes you don't have to say everything. You can share everything, but not necessarily share everything, if that makes any kind of sense. Parents, I get to know the parents. A lot of times I'm building trust. You're working with a youth. These parents are trusting you to role model recovery. They're trusting you to take their child out of the home and to make things better. A lot of times parents are spent, they're tired, they're exhausted, and sometimes you might be the last resort. So I get to know the parents. I will talk to them. I will get their feeling. I want to, like, what are their beliefs? How would they like things to go? Like, I would get my kid clients to share what we did, and that way empower them and be happy with them. And I would encourage communication and questioning. And most of the time I had success, and sometimes I didn't, and that's okay. It just is what it is. Karina says, in a small town, it is easy for people to find out that your client works with you because in a small town, everybody knows everything. People start rumors too. That's why I ask, how do they like to introduce myself? Yes, that is key. I always say, hey, I just want you to know, I'm not trying to be rude. If we're out in the community and you ever see me, I can't come up to you because I want to protect your privacy. But if we're ever out with friends, how do you want us to introduce? And some will say, oh, you're a friend. Some are really open and they say, hey, this is my peer support, this person I work with. Even though they say that I'm their peer support, this still does not give me permission to share information. I can agree, yep, that's what they said. Sometimes I've worked with teenagers and I've been the cousin of a friend visiting from out of town. I had one teenager who I was their bodyguard. They thought it was funny and it was good. when I am with them, let's say we are out in the community and we're introducing and someone asks me a question and then it's already been acknowledged that I'm their peer support provider, I will always turn to them. So if someone asks me a question and it's like, ooh, I'm not quite sure, I don't have a release of information, I didn't get permission to share this. I'll turn to the person that's to the client that I'm working with and I'll say, are you comfortable with me sharing this? Or maybe I'll pull them aside and say, hey, this is getting a little too personal. Are you comfortable with this? We can either stay or we can leave. All right, so overlapping relationships and dual relationships. So in rural communities, this is very, very common. You know, people go to the same church. There might only be one doctor in the facility. The area. They might have the same lawyer. They might have the same pastor. They might have they might go to the same school. Or you live in the rural community and you're working with this person. And so it's really important that sometimes in rural communities, this is unavoidable. Sometimes you're put in a position where there is going to be a dual relationship. You have to set good standards. You have to set good boundaries. Define, okay, so now that we're working together, what does this look like? And always do check-ins and make sure that the person you're working with is comfortable. And let's say you're working, you have this dual relationship. You don't keep it sexual. You keep it strict boundaries. You don't, what am I trying to say here? If at any point the client starts to feel uncomfortable with this, you need to take the high ground and end that working relationship. Because at one point, we never want the client to be uncomfortable. That's a balance of power. If you find that you're in the community and they want to work with you, but they're getting uncomfortable, there's a balance of power thing as well. Like you have to learn to know when to walk away. And sometimes when we work with people, they're only in our lives for a short time. Maybe we were supposed to work with them to get them to point A, and they need to meet the next person to get to point C. All right. Number 2 is ethical boundaries between mental health providers, caregivers, and families. So this is, once again, it sounds like boundaries they can be tricky. Especially when you're in a rural community, especially if you've never worked in this field before. And as you grow professionally, your boundaries grow as well. I would hope that when you're working with somebody that you are in an agency or a company. Oh, shoot, sorry. I have my phone going off. Okay, I apologize for that, you guys. Boundaries. Oh, that phone threw me off. Altered boundaries between mental health providers, caregivers, and family members. So people, when we start working as peer specialists, I have found that a lot of times they want to be my friend. And so I have to remind them that we can be peers, but it's my job to show healthy boundaries. My role in their life is to teach them and encourage them on how to be good friends, on how to set healthy boundaries with their family members, learning to advocate for themselves, learning to say no or yes. When they're with healthcare providers, if they're out in the rural community, maybe the doctor or the nurse or whoever they're working with might have some different boundaries. I've worked with a couple of nurses that knew in the community that knew of the clients, and they would always ask, well, how are things going? They just felt like they had this connection to the client, and they felt like they could be privy to the information. And so I hope this makes sense. Just maintain high standards of boundaries. If you're not sure, always reach out to a supervisor. If you're not working with a supervisor and you're working with a volunteer place, make sure that they have a licensed counselor there or a supervisor, anybody that you can go to. And you'll know when you need to speak to somebody about boundaries as if you start questioning and you start doubting in the services that you're providing. The next one is difficulties maintaining patient confidentiality. So this is one where I always have an open communication. So if I'm ever meeting somebody and I'm working with them, I immediately go over, that I'm a court mandated reporter. If you threaten to self-harm, suicide, or you want to hurt somebody, I'm going to have to, report. However, the stuff that we have is private. And I review what a release of information is. A release of information allows for us, the client gives us permission to talk to other entities, to other people, to agencies. And it's generally good for a year. And within this release of information, it tells you what you can and cannot talk about. But I've also found that just because we have a release of information doesn't mean that I get to call them and talk to them whenever I want. I always make sure that my role, I really, really believe in working with clients to advocate for themselves, to learn how to communicate and learn how to make healthy decisions. And so if I have to call somebody and I have a release of information, I'll always confirm first with the client. I'll always ask them, what are you comfortable with me sharing? What are you not comfortable with me sharing? And then once again, let's say we're out and about and we go to church, or we go to a local school, or we go to a local restaurant and we meet somebody there, and the person comes up and they're not respecting the client's boundaries and they're asking uncomfortable questions. I will turn to the client and say, hey, do you feel comfortable talking about this? Or maybe if we know that this is already happening, we'll come up with a code word, or we'll come up with something like, oh, this person's coming, I don't want to talk to them. And you're like, okay, we don't need to stay. My job is to role model setting boundaries. You don't need to stay in an uncomfortable situation. We can walk away. And then also I let the client guide. They're using their voice. So if they feel comfortable sharing, it doesn't mean that I get to share. They get to share as much information as they want. I will always ask, are you okay with me sharing? So there's limited support for mental health professionals to seek ethical advice. Yes, but there's always somebody out there. First off, we as peer supports, we have our code of ethics. There is a standard to follow by. And when in doubt, if you're already doubting if it's ethical or not, they're probably on a fine line. You're probably teetering on not doing something ethical. There's always licensed counselors you can reach out to. You can go to a church, go talk to a minister and get their advice. You can reach out to a counselor or a coworker. There's always somebody that you can get advice from. And if you can't and you feel yourself stuck, from my own personal experience, listen to your inner voice. Generally, we're right. Try not to ignore it. Stop what you're doing and just reevaluate, take your time. And you don't have to make a decision right there and then. And I've also found that if you're willing to bend on one thing ethical, then you're willing to bend on the next thing. And it always gets more and more. I'll give an example. I have a coworker who's going to school, become a social worker, and they had a really good relationship with the client that they're working with. And they've done a lot of work with this client. And so they reached out to me and they go, hey, I know that I'm going to school, but I've really done a lot. Are you okay if I work with this person afterwards? And the answer is immediately no. I said, first off, our role is to encourage people to become independent, to have good recovery, learn how to advocate and have healthy boundaries. And I go, this is also against this code of ethics. And if you let this one bend, what's the next thing you're going to let bend? What if somebody becomes suicidal, they want to harm themselves? Or what if you're ever put into a harmful situation that you can't get yourself out of? If you don't keep these ethical boundaries, it just causes trouble. High burnout of mental health providers. This one happens a lot. Sometimes when I don't have clients anymore, but when I was working with clients, I found myself that if I took on their stress, and so I wanted to help them so bad that I didn't always have the answers with limited resources, such as there's limited housing resources right now, and it sucks and it's hard. And you want so badly to help somebody, but you can't. So that would cause me immense amount of stress. Or sometimes I'm working with somebody and their stuff triggered my own trauma. So I always had to keep myself in check. To be a good peer support, I believe, is practicing good self-care. You're always having somebody that you can talk to, that you can reach out to for help, recognizing when you need to take a day off, recognizing when you need to reschedule an appointment. Burnout is real. A lot of people tend to not stay in this profession too long because of burnout. But if you can keep boundaries, if you can keep yourself in check, if you can make sure that you have the support you need, and then also sometimes working with clients, they're not a good fit. Our jobs are not to save people. Sometimes we just don't mesh with the people that we're working with. And sometimes it's for that burnout is learning when to walk away and saying, this is enough. I think you would do better working with somebody else. Okay, where's the next slide? So obviously, I'm going a little too fast. Does anybody have any questions, concerns, or anything they want to share in the chat where they've had a similar experience or they've had to deal with something like this? Okay. So we're going to go ahead and go into a breakout room. In this breakout room, just go ahead and introduce your guys, introduce yourself, share your experiences of what it was like if you currently work in a rural community, having limited resources, how it's affecting your job, and what are some tricks, tips and tricks that work for you guys. And share examples, and then pick somebody that's in your group that after we meet from the breakout group that we can have an open discussion. I'm willing to talk on the chat. I'm willing to answer questions for anybody that raises their hand and they have a question. Yes, burnout is very real, especially with chronic illness. Yes. A lot of the people that we work with have chronic illness. A lot of it is, they do have something physically wrong with them. But also stress can cause chronic illness. And so a lot of times if we can get them the support they need, that'll go away. But also if we as providers need to recognize our limitations. All right. Anybody else have anything before we do our breakout group? All right, Mary.
Okay, I'm going to send you to breakout rooms now.
It's good to see you. Hey, welcome back.
Yeah.
I hope you guys had some good discussions. All right. So I can open up to the floor if people want to share, or I can also ask, like, go by room, if I can have somebody from, room 1, if you want to share what you guys talked about, or some examples that you have.
So Danny, room 1 is still, they're all out now, so they're all returning, but I just wanted, okay.
There we go. Can you guys all hear me okay? I hope so.
Yes.
All right, thank you.
Yeah.
Does anybody want to share some of the things that you guys talked about? Maybe we can have a little discussion going on.
I can share.
Or,
Help me. Sorry, I didn't raise my hand officially.
it's okay, go for it.
Oops. We were just talking about how access to resources can really be a struggle in more rural areas, in particular housing. When someone is really struggling to find housing, how frustrating it can be for them, how frustrating it can be for us to feel like we're not able to assist or support them in that. So yeah, that was, I think, just connection to resources was really, really the main thing we discussed.
What was something that you've done in the past to help with that? And has it worked?
I guess something that I've done is just relied on my personal community connections to try and just come up with as many ideas and as many people to connect with as possible. Because really, I mean, my role is not to solve the problem, but to just kind come up with ideas and to support the peer in them finding solutions for themselves, right? And um, you know, it's in Idaho also, in rural communities also, it's oftentimes who you know. So um, that's something that I've done is just ask myself, okay, who do I know who might be able to assist my peer? So that's been something that I've tried.
I've done that as well, and thank you for sharing. I've also found that sometimes the clients I was working with, were uncomfortable with speaking with that particular person or that resource. So it's always to make sure that it's okay. And I definitely recommend release of information before reaching out.
Absolutely. Yes.
Thank you. Anybody have anything else that they talked about?
We
Yeah,
just
can you hear me?
hello.
Hello?
Erica, go ahead. I see
Oh,
you.
sorry. Yeah. I was just gonna say we just talked a lot about like burnout and self-care and kind of what our self-care techniques were and how important it is to remember not to like enable people because it's like I can't remember quite who it was. I think it was Linda. Um, but she was talking about how it's like, if someone's drowning in a pool and you go in after them, then they're going to drag you down too. So keeping yourself, like basically putting your mask on first before you start to help others. And I really like that. That's a big piece of my recovery and um like I've seen that go the bad ways. So I really enjoyed that conversation.
That's a really good conversation. Thank you. I've also experienced that, and I always say this saying whenever I'm done with an appointment. I always go, I've done all that I can today. And it just reminds me that I've done everything that I can. I've given them the tools. We've reviewed the tools. Now it's an opportunity for them to try. And then this was also something I had to learn a long time ago was it's okay to do trial and error. It's okay if things fail. Our job there is to teach people how to problem solve. How if something doesn't work out, they have a way that they want to try because they're the ones leading their recovery. So if they want to try to access a resource, we maintain our boundaries, we go over the pros and cons, and we practice it. And sometimes it fails, and then we have to try again. But we continue to encourage them to advocate for themselves. And then in our own personal self-care and boundaries is setting your own limitations when you're working with people. Let them know what you're comfortable with doing and what you're not comfortable with doing. And it's okay to say no. I say no quite often. But I also say no, but then I'm like, okay, let's find a different solution. How can we do this differently? Anybody else?
Can you hear me?
Yes.
Okay, this is Karina.
Hi there.
Hi. I know that I was talking to one of my coworkers and I told her that I was getting burned out with paperwork. Um, I I'm fine if I open my laptop, but once like I struggle. I'll like have my laptop on my lap and I'll sit there for I don't know how long. And it's like just hard for me to open it.
I 100% get that. If anybody has any tips, go for it. If not, this is what I do all day. I train people on how to write notes and be efficient in writing notes.
I'm a good note taker, but just to get there is a struggle. So I was wondering if anyone had any motivational speech for that.
I tell myself I'm just going to do it for 5 minutes. That's all I'm going to do. I'll even put a timer on and be like, okay, I'm going to do it just for 5 minutes. And then that's sometimes helps to get me at least to open the laptop. And then once I'm going, I'm going.
Okay. Yeah, once I get started, I'll be fine. Yeah, an alarm though. That's a good idea. It's a good idea. Anybody else?
Anybody else?
Danny, you got a couple people with raised
I
hands.
can't
So
see raised hands.
okay, they're in the corner on their on where their camera is at, if they have a camera on, but I think I'm pronouncing that right, but I'm not sure. She's got her hand raised if you want to say something.
Yeah, that was actually really close. I'm very, very impressed. Like usual, my name's like super ethnic Mexican, so like I very seldomly do I actually find people who can pronounce it. So
Well,
thank
you
you.
put it in the chat, so I took a look at it.
Oh, that makes more sense. I was like, dang, man, she is good. Um, um, yeah, so in our meeting, we kind of talked just about rural resources and just the lack of resources. And I thought it was really nice to just have that mixed or diverse backgrounds of experience. We had a gentleman who worked with refugee populations, and then somebody who was from Orofino, Idaho, and super rural. So it was just really nice to have that. I had two questions. And one of those was, could we possibly get like a sample of what good notes would look like? Just because I think that like maybe your definition of good notes versus my definition of good notes are completely different. Like, because there's not really a lot of universal stuff on that. And then the second thing that I was going to ask about is, so I'm not a certified peer support specialist, but it is something that I'm interested in doing. I do a lot of work with the Juvenile Justice Commission and nationally. And so I think like just as somebody who's really passionate about working with people from similar experiences and like elevating them to that next tier of like where they could be at, I think it'd be really nice to be able to have like a very clear cut, streamlined process of like, okay, you get certified through like this list of providers, then you guys can go to BHA and then you guys can get tested to see if you guys can qualify for Medicaid funding. Just because like for me, I'm exceptionally well connected to a lot of different people, and this has been one of the most confusing processes that I've had to try and navigate. And I'm very thankful for the people that I do have in my corner, because if it wasn't for them, I would have absolutely no idea on like where I would go to get started on this. And I just think, that as we kind of talk about peer support specialists and the lack thereof, or even for family support specialists, it might be nice to have just that clear, streamlined process for people.
Thank you for sharing. I have some suggestions and I have some ideas. So I'm going to go back to writing notes. So these are some things that we teach some of our providers because, at the end of the day, it's exhausting sometimes just to get on and write the note. But the hardest part is just the paragraph, the sentences that you just need to write. I would have a Word document and I would just type out everything that I did. And then I would set aside a day. So Fridays was my note day. I would get all my stuff turned in. And I would just copy and paste. I already had the bulk of what I was going to write, which was in a Word document. And then I can just do session details, the time we met, all that other information, the goals that we worked on. With us, it's all clicking. And then I just had to paste on. And so that would take less than a minute to get that note taken care of. If you don't have, like sometimes in rural areas, you don't have the internet. There's no way to do that. I would actually write out my statement on a piece of paper. And that way, all I had to do was just quickly type it, because I found that if I went back later to write my notes, sometimes I didn't remember what we did. And even if that's not the case, I would have a sticky note and I would write out. So if I met with a client for an hour, I would write out 4 things that we worked on, because we write 15, what we did for every 15 minutes that we worked with a client. So I'll write out just a simple statement. And as time has gone on, it used to take me 10 minutes to write a note. It takes me anywhere from 2 to 3 minutes now. I'd also say go on your phone and just make sure, like for privacy stuff, you don't say the client's name. Do you text to talk? You can talk and it'll type up, like when you're just talking your phone, lay out your note that way. You guys also have the option of writing the note with the client's present, because this is their recovery. This is their care. So like the last 7 minutes of the appointment, sit down with them and say, hey, we got to write our note. What do you want me to say? And this will empower them to stay on track with their own recovery and to work on their goals. And they'll feel like they're a part of it. And sometimes I've worked with teenagers, and I worked with a client through the children's mental health program, and we had to say how often she was working on her goals and what percentage she was getting. So like, do you feel like you did this 20% today, or 14 or 50%? And she says, tell them 62.42%. And so she just had fun making it, just having control in what she was writing. And then setting a day aside. You know, maybe you do your notes every other day. Try to get your notes done before the weekend because you don't want to ruin your weekend. I know about me, like come Sunday, I'm just dreading it. And then it just felt like my hands were so much heavier and I couldn't open the computer and I was angry and I was disgusted and I just felt like I wasted my whole weekend. As for writing notes, in our agency, we use buzzwords. And so if we do a 2-hour note or 1-hour note, for every 15 minutes you work is a sentence. And so buzzwords have been around for a long time. I don't know if you guys use buzzwords, but it's easy to create a sentence. So like within an hour, you have to do 4 sentences because there's 4 15 minutes in each, and then 1 client response. And so then if you work 2 hours, it's going to be 8 sentences with 2 client responses. And so you start with a struggle, and then so client is struggling with speaking up for themselves due for fear of talking to people. So PS accompanied the client out into the community to a local store. PS role modeled calm behaviors and for the client and encouraged the client to practice self-care and coping skills to manage their symptoms of anxiety. PS role modeled with the clients prior to role modeled what they were going to say to the store person, and then PS observed while the client was talking to the store person. I mean, it would be easy. It would sound better than what I just said there. And then the client, you either share their response, like client said that was too much. Client shared that they were happy to get it out of the way. They still need support. Your notes should be just how we share is like, you have to remember, sometimes these notes get audited and people look at them. And so you want to be sure that you're thorough in your documenting, but you also want to protect people's privacy. So I've always learned, and I learned this from another agency, and then the agency, I've been doing this since 2012. So the client wants to go to the YMCA and they want to work out. So you don't say, took the client to the YMCA to sign up for a membership. So instead, accompanied the client to a local gym to sign up for a membership. Assisted the client in seeking out counseling services. Well, if this gets audited and someone sees the agency they went to, you can also then just say went to a local counseling agency. You're documenting the truth, what you're doing, but you're also protecting the client's privacy. And then as for writing notes, if you guys are interested, this is what I do. It's one of my passions. Might not sound like it because I'm stumbling over my words, but I love training people. I'm willing to share my email if you ever want to have some support learning how to write a note. Anybody else have anything they'd like to share?
Danny Brandy Cassell has her hand up.
Go for it, Britt. Sorry, it's hard for me to see the hands.
That's okay. I can let you know.
Thank you. Brandy, you're muted.
Okay, I think I figured it out. Sorry. Can you hear me now?
Yes.
So that was what our kind of group talked about, was like finding things and activities to go do. And most of my people live in bigger places. I am in Idaho, so there isn't much, and I'm a kid and peer, so we kind of just talked about looking at Facebook for different events that are around you. I look at the library, like for any type of like car shows or anything, because you can always teach goals in the car. And with kids, you're always teaching goals, of how to act in public and stuff. So we were just kind of, and then the one lady said about the gym in the winter. I never even thought about that. We do the YMCA, but it's so far away that if you do hours consistently, you need like 8 hours. So like resources is hard for us to find. And I don't know any more other ways than that. Do you have any suggestions? And that's what we kind of just talked about, was what to do with our clients for activities.
Okay. Definitely the local library. If they belong to a church and they feel comfortable and they want to engage in some of those activities, some of those resources. There's this magazine called the Family Christian Magazine. You can go to a gas station and you get it. It's like where the free newspapers are. They have in their monthly things of that's happening in local areas. So I used to work out in Caldwell in that area, so they would have like free kid
Okay.
events. Or there's look for local museums in the area, or if there's a local park, or other agencies that are like our agency does a once a year fishing event. The other thing for like resources, if it's not just like kid related, looking for fun things, remember the phone number 211. So that's you can call somebody and they know all the resources pretty much for Idaho. And so you
Okay.
can call with the client and they can listen as you ask for questions like, I'm needing some, resources to pay my power bill. So you call 211 and someone's on the line doing some research for you while you're talking to them. And it's
Okay.
for Idaho.
Okay, awesome. Thank you. And I would love your email to talk about
Okay.
notes because I'm building a program. And so the clinicians don't understand what prayer support is. And so explaining to them and the whole note thing to them is just been so difficult to build from
Okay.
going working with somebody. So I
And
would love
I definitely have the buzzwords and I've got a training thing as well that shows how
okay,
to.
okay, awesome. And will you put your email in the chat?
Yeah, so I'm not computer savvy. So once I start the link again for the PowerPoint, I'll put my email in the chat.
Awesome. Thanks.
Thank you.
Thank you for your time.
You're
Mary
welcome.
also sends a follow-up email with the survey link, the slides link. She can also include Danny's email in that email as well.
That'd be great. Thank you.
For sure.
Anybody else have anything that they've talked about?
Darla has a
I
question.
see it now. Hi, Darla. You're muted, Darla.
Maybe Darla didn't know that she turned on, she raised her hand.
There.
Oh,
Hi.
there you are.
Okay. Hi. Okay, so I just wanted to say in response to was that Brenda? Is that who was just talking?
I think it was Brandy.
Brandy, okay. If I find that if somebody needs more time with me, instead of 2 hours, I will do like every other week and work with them 4 hours. And it kind of sounds like things are far away because you're all the way in Emmett. So I just thought I would give that as a suggestion if you haven't already thought of it.
Speaking of the hours, are you guys familiar with the units and how they work? So peer supports, family support, they get 416 units a year. And so since Magellan took over for Optum, they started the units brand new again. And so those units go from July 1st until December 31st. And so a peer support can work with a client for 4 hours a week. It's authorized. But then start January, they're probably going to go back down. It'll go back down to the 416 and then it'll be units. And then that equals 2 hours a week. And so when I work with clients and I meet with them, I like, hey, looks like we have some extra units for until December. We can work for 4 hours a week if you want. But then after that, it might go down. And then also consider there's vacation time. They get sick, you get sick, something happens or whatever, you guys bank up those units. And so there might be some times where you miss a week. So then the next week you can work 4 to 6 hours. So I would get familiar with whoever you're working at, the units, what's authorized. There's always a workaround. Did anybody talk about like lack of insurance to pay for services? Like what if you're working you're volunteering for peer support and somebody out in the rural community needs some insurance? Are you guys familiar with resources there?
What do you mean? They don't have insurance, you mean? And
Yeah,
we're
well, I think
volunteering our time?
there's some peer supports that I think there's some like where they're doing it voluntarily, like they don't actually have insurance to pay for the services. They're working with somebody voluntarily. I just found out this interesting thing I wanted to share with you guys. So Magellan has this thing, and I don't exactly understand how it fully works, but I have a client that doesn't make enough money. I mean, he makes too much money to have Medicaid. So Magellan has this program where you call them and you apply and say, hey, I need some help. And so then they'll authorize services. They'll pay for counseling for 30 days. And then they have to show proof that they applied for Medicaid. And then if they get declined for Medicaid, they then have to show them, and then Magellan will pay for a year of service.
Year of counseling services?
Year of counseling and or more, depending on their needs.
Oh, yeah, that's new. I didn't know that. That's through Magellan started that.
Yeah, and I just found this out a week ago.
Okay, that's good to know.
Yeah.
So they just contact Magellan.
They just, yeah, they have to contact Magellan, then they have to do an assessment over the phone.
Okay, that's good to know. Thank you.
You're welcome.
We talked about transportation in our group and how, and I didn't realize that even in Southern Idaho, that MTM drops the ball just as much as they do up here in the north. I thought it was just an issue up here because there's, you know, so we're so far from anything that, but it's terrible. But they said that transportation with Magellan is going to be a top priority. Let's hope so.
Oh, I hope so.
I hope so.
That one's always a tricky one to work because we tell our providers they're not obligated to drive anybody. If they choose to drive somebody, that's their personal choice.
Right.
And we don't, it's not our job to take them to an appointment, but if their appointment happens to be close to where my next client is, I can drop them off. I'm just not going to take them back home.
What about water issues?
Like paying for water or accessing water to drink?
No, I'm sorry, that, yes. Like you, I think you said something about, somebody said taking their client fishing.
Yes.
Years ago, I remember, and this was CBRS, but or PSR at that time, told, you know, don't take your clients to water, it's too much of a risk. And so I just held that rule of thumb. So what is, you know, they fall off the dock into the water, they drown. Oh my God, terrible, right? So really, what is well, now Magellan's policy, does anyone know regarding taking a client to water, even a pool where there's a lifeguard? Does anyone know? Talking about
Yeah. I'm not
because
sure
of
of
things to
Magellan's
do.
policies, but with our agency, we have a release of liability. So we're able to go fishing with them, we're able to go swimming with them, go hiking, do all kinds of stuff. But they sign a consent form that something could happen and they're taking that risk. And then we ask them that they do safe things. For swimming, I tell my providers they can only go to where a pool where there's a lifeguard. We encourage people to go fishing all the time, but then you just have safety conversations with them. But then you also assess the client that you're working with. So I've had some that were able to fish, and then I had one that had Parkinson's and scared me a lot. So when I took her fishing, I made sure that I was in a safe environment. I'm not going to be on a skinny dock with her fishing. I'm going to be more in an open area. And then maybe if her needs were more and she needed more care with me watching her, so maybe I would just watch her fishing versus the other clients that I'd be fishing with. And then also remember, if they're on disability, they just need to show proof and they can go to the Idaho Fish and Game and get a discount fishing license.
Right. So you said the other clients that you're with, you'd watch her more. Do you take more than one client out at a time?
No, sorry, I don't take more than one client out. So I had one that had Parkinson's, and we made sure that we were in a safe environment. But then I fished with another one, and we were on the docks. You just kind of see where the client's needs are. And then if you're afraid, don't do it if you're afraid.
Oh no, I'm not going to. I've pulled two people out of the water
Oh,
in
no.
my life, and no, I don't put that. I don't put myself there.
The only thing that would also be challenging for me is because I used to work out in Weiser Payette and all those other areas. If I was going fishing in rural areas, I would first off tell people where we were going. And second, I would kind of make sure that I wasn't just the two of us. Because you never know what's going to happen. It's easier to fish out here in Boise. There's a lot more people around.
One thing that really put me at ease with all of that too is just getting like my CPR certification and making sure I'm staying up on that, just so I know that if the time comes, I do have the capability to, help someone in need if that's the case.
Perfect. So I have what I
Thank
was
you.
going to do is I'm going to go over some of the other slides again, just to kind of go over my past experience. But if you want, we can continue this discussion for a few more minutes. Does anybody else have anything to share? If they have any questions?
Really
Emily,
fast.
before- Mhm.
This is Emily. Something that we kind of talked about is sometimes it's really, really hard to go to work because you're tired and you want to do other things. But it never fails for me when I have those days and I go to work. I'm always able to share my life experience with one of my peers, and it makes their day. And so I always know I need to do that. I need to think of them and be ready to help somebody else, one of my peers. And just the other one is we talked about self-care, because I know we were talking about if I don't do self-care and I'm not feeling great, how in the heck am I going to help one of my peers do self-care? Am I making sense?
Yes, you are 100%.
Because that is one thing that we talk a lot about with my peers is how whatever they want to do, if they're able to just focus on that, do whatever you want within reason. But I know that I do self-care with some of them, and we've done things like lava lamps and things like that, and they get so excited. I mean, we do it and they use it all the time. It's just a way to distract them from what was going on in their life. But I found that I got to do the self-care. It has to be a priority for me. And then those days when I don't want to be there, I got to get out of my head and I got to think, what can I do to help my peers today that are struggling? Those are things that I've thought about, and we kind of talked about those in our breakout room. But I found that those are very important things I need to do every day.
Thank you for sharing. Those are really good insight, good suggestions. I found the times that I didn't want to go work, I had to figure out why I didn't work. Was I hungry? Was I tired? Did I need to take a 15-minute break? And then I always told myself, I can always go. And then if I need to end the session sooner, I can. But I can at least give it 30 minutes. And most of the time I would end up doing more time because I ended up having fun. Maybe I was dreading it because I didn't want to go do the activity we were doing. And so I was anticipating us going to do something, but then when I get to the client's house, they changed their mind. They didn't want to do it either. So that stress went away. Also, I'm working with clients. We definitely have telehealth now, and sometimes they struggle to get out of the home. Sometimes they struggle to talk, and sometimes they're afraid. It usually takes a good 30 days to build rapport with somebody that you're working with. So I always tell them that talking's not a requirement. And if they feel like they want to cancel, give me 15 minutes. And after 15 minutes, they want to end, that's great. And so there's been many, many times that I will meet with people and they say, okay, I'll give you 15 minutes. And then maybe we go for a walk, or at the time, if I've got the gas money, we'll go for a little nature drive. And there's no need to talk, because you have to remember, some of these people come from chaotic homes. The only time they get quiet and relaxation and some sort of peace is when they're working with you. And it doesn't matter if you're in a rural community or working in a city community. Family life can be hard sometimes. And so generally, maybe after 30 minutes of not talking, I'm role modeling self-care, I'm role modeling calmness. They start talking and they start having fun and they thank me. And you're getting them out. And remember, movement is important. So then I always praise them. I said, you know, you've earned your nap today. You've done all that you can today. I'm really proud of you. Anybody else have anything? These are some really good discussions, by the way. All right.
I agree that a lot of my clients, the only person they interact with during the week is either their therapist or me, and that's it. There's no family around, they don't have friends, and so I know how important our job really is for people, for sure. Thank you for bringing that part up.
Yeah, thank you too.
One thing that, can you hear me?
I can, go ahead.
One thing though that like I've learned in the past too, that it's okay to say if you're having a mental health day, not to go to work, because you know, I'm very dedicated to my clients, my kids, and I don't want to, I have approval addiction anyway, so I don't want to let anybody down. But I've also gone to work not in the right headspace, and the client has felt it. And you know, some clients know how to use this system. Some clients like to be angry and not understand. That's what we're teaching them, right? To be compassionate. And so they want to fire me, you know? So like they can feel if you're having a bad day. And some are understanding, and you have to know your client's good enough that you can work through it. But I've also learned, and I've told my bosses, I won't go anymore. I'm peer support, right? So I got to take care of me. I'm just a little further along in the recovery of the people we're trying to help. And so I've learned to say, I can't work today, and be honest. Like, I'm not in the good headspace. Does other people do that too? Or
Yes.
No,
Definitely.
go ahead, Derica.
I was just gonna say definitely. I definitely do that. Like, especially with, you know, like I have chronic illness and disabilities, and like if I don't take those days, and we kind of talked about that in our breakout, like if I don't take those days, my body will pay me back for that, you know? So taking those days is really important. And that's like the first thing that I tell people when I'm setting boundaries right at the beginning, is saying like, hey, I want to let you know that, you know, I have these things in my life that are going on with me. I'm a person just like you. And there will be days where if I'm having a flare up, I'll let you know as soon as I can. But sometimes I don't know until that day. So just setting that boundary right from the beginning and letting people know has definitely helped, like, my connection with peers and other peers going through chronic illness and stuff like that. So I definitely agree.
Thank you for sharing. Joy, I see your hand. Go for it.
I couldn't figure out how to do the hand thing on my phone. I totally agree because I'm disabled too, and I've lasted almost 15 years doing this. And my big thing is balance in life, because I kind of mentioned when we did the breakout about the airplane, you know, putting the oxygen on yourself before your kid, which is hard when you're a mom and a grandma, but it's very important because you can't take care of anybody else unless you take care of yourself. But I believe in balance, because it's not just about, you know, taking care of yourself. It's also taking care of your family, being involved in your community, and your clients. So to me, it's that balance between all, and you know, your medical doctors and all that. And that's how I've survived this long. So that's what I believe in, balance, and definitely being upfront when you have chronic conditions is very important. And it's worked for me. So like when I call a client, I'm like, you know, I got one of those migraines again today. You know, they've never given me problems about it.
Have you guys ever come across, Joy, thank you for sharing. Have you guys ever come across a client that's angry, that just doesn't, that wants you to show up and doesn't listen? Like, how do you maintain those boundaries? Like they get upset, they'll call the agency, they'll yell at the admin staff.
I've had one client that did that when I worked for the PATH program, and it wasn't me that they got angry with. It was the fact that I couldn't give them the housing money from the PATH program because they couldn't get the landlord to sign the tax form, because I guess they didn't want to count the taxes. And so the dad called the company and was like, yeah, and I even showed up on my time off to fill out the forms for her because I was out of time, just because she needed the housing. So I did all that. And then he called and complained to them like, oh, she smelled like cigarettes and blah, blah, blah. And she didn't get the form. And I was like, she couldn't get the paper form. It was out of my control. But I just said, you know, if she felt more comfortable, we could get her assigned to somebody else. I want her to feel comfortable with who she's working with. That's all you can do, because not everybody's going to be, you can't connect with everybody. So just find someone that they can connect with and not take it personal.
Thank you for sharing.
I kind of talk to the counselor, because then a goal maybe we could set, you know what I mean? Like, or, and if the counselor, here's their side of the story and here's my side of the story, you know what I mean? Because there is two sides to every story, and you do let people down, but they have to learn to live and understand that. So, like, if they get mad on the text message, I'll say, well, we'll talk about this later, but I hope that you understand that this is my boundary, like you said, that I said at the beginning, that I got to take care of myself first because you're teaching self-care. But sometimes they do fire you and get mad and get angry, and the counselor has to work on it and they rehire you, and you just have to be open to rehire him and going back and teach them how to say sorry. I don't know. That's just what I did because I've been hired and fired many times.
It happened. All right. So this next step I was going to go through is just go through some of the old slides again and just share some of my experiences. So I can do that, but I can also do question and answering here. So I'll do it. I was thinking maybe of asking you guys, what do you do? Like if you're out in the rural community and you feel uncomfortable and you feel unsafe, or that signal comes up and says something's wrong. How do you guys manage that? Do you guys listen to your inner voice? So me being a lesbian, going out into a rural community, I have my own biases. I have my own stigmatism, not stigmatism, it's stigma. Like I assume that because I'm going out into a rural community that I'm going to meet some hate, but I have found that most times it's not like that at all. A lot of times I'm working with clients that are already outside the social norm there. They're already wanting to break away from their own community, and that's it because they couldn't fit within their community. They felt a little different. And so if I went out and I felt unsafe, I would assess the situation. I would always make sure that, I had my car keys. I always made sure I had full tank of gas. I'd always look around and see what my surroundings are, make sure that it was safe. If I was to meet in a client's home and I felt unsafe, I'm not going to go in the client's home. If I see a lot of cats, I'm allergic to cats. I'll have an asthma attack. I'm not going to go into their home because some clients have like 15 cats. Is there anybody else that has any suggestions on how you guys stay safe? How do you listen to your inner voice?
I think for me, like, just like with the CPR thing or anything, is like, I feel safest when I'm prepared. So having like a survival kit in my car, having enough water, taking classes for survival or like simple self-defense, or learning, kind of how to, like, I am crisis intervention trained. So like knowing certain holds that hopefully I don't have to use on anyone. And luckily I've never had that, spidey sense tingle in my brain. But knowing certain holds and how to kind of like subdue someone if I'm, feeling like in danger or feeling like I'm being attacked, like just certain things like that puts me at ease and makes me feel like I can handle the situation, and just being confident in knowing that I can handle the situation.
Thank you. It's really good advice. So in the rural communities, we had mentioned earlier that there's higher rates of suicide and addictions and substance abuse. Sometimes we're the only people that are supporting these people. What if you come across someone who's feeling suicidal or is an active addiction? Do you guys know what to do? How to maintain those ethics, how to maintain your personal boundaries? Do you guys have any suggestions? I clearly have suggestions, but does anybody have something that's worked for them? All right. So normally when I first meet with somebody, Joey, go ahead. I see your hand.
So I would say here at Mariman, we're all QPR trained. So we're all trained to be able to ask the hard questions. Are you suicidal? We live in such a small community that we are, we know that we have to keep them on the phone, and we flag someone else in our office and we have them call behavioral health, and we make sure that we get someone down here to be able to hand over the phone, because we know that we cannot transfer them. We can't hang up. We can't do anything. So we are QPR trained here to be able to handle those situations. We also are very unique here at the Coeur d'Alene Tribe, and we deal with addiction and overdose every day. With that being said, we do, you know, we are in a small community and rural that we do all know each other, and we're all intermingled with our family members and things like that. So when we do our staffing here in our department, we're able to make sure that we are not dealing with conflict of interest. There is moments where we do, right? Because we are related to everybody. So with that, we just make sure that we are meeting and making sure that we are protecting each other, but we're also serving our community to the best of our ability.
Thank you for sharing. I like that. In my agency, this is what we train people. So when they start working with somebody, their very first appointment, you should remind them that you're a mandated reporter, that if they're experiencing suicidal thoughts, that you need to report if they're going to hurt somebody, or if you've heard them, of someone like a child that's being harmed, we do need to report it. And then we work on them advocating. So if they're the ones that are reporting it, we work on them advocating and how to speak up, and we'll be there when they make the call. And if they don't make the call, we'll show them how to make the call. We let them know that if someone's in active addiction, we're not allowed to work with them because they're in an altered state of mind. So pay attention to those signs. If you show up and someone smells like alcohol, end the appointment. That's our policy. If someone clearly shows that they have drugs on them and they're using drugs, end that appointment. You don't need to work in those situations as putting yourself in harm. And they came to you to be in recovery and to have a better life. Choosing those choices or not doing that. If someone is in active suicidal, if they're hurt or harmed, and I'm out in a rural community, you dial 911. We tell our providers they're not allowed to take them to the hospital. They're not allowed to drive them because what if they slit their wrist? And if I'm triggering anybody, I apologize. Please make sure that you reach out to somebody afterwards if you need support. But let's say they're active suicidal, and they've tried to attempt, you call 911, because if they're in the car with you and you drive them and something happens, you can be held liable. And so also have that conversation with them if you know that they are somebody that attempts quite often who has a substance abuse. And then definitely get some help for you. I hope you guys are working with agencies that will help you write an incident report. We'll have a counseling, somebody that you can talk to, because you can have some trauma and that can further burnout for yourself. Okay, where's this next one? So the other one is there's agencies that do services in rural areas that have limited staff, high turnover rate, and long wait lists. Let's say you're working for a company and you see this a lot, which is very common actually, especially in Idaho. You know, a client has a good connection with the person they're working with, and then the person they're working with for some reason can't provide the services anymore, and maybe you have to take them on again. How do you guys deal with turnover rate and you know, clients being on a long wait list? Like, do any of you guys have to deal with that? I'm more in management, so that's something that's more that I deal with. I don't see any hands.
I don't know how to do the hand thing here.
All right, go for it.
So I'm the only PSS in Boundary County, and probably, I don't know who's still, I don't think anyone in Bonner County is still doing it either right now. But anyway, so, you know, I can only do what I can do. And so I'm hoping that there's going to be more trainings and people wanting to attend those. And you know, they're a little spendy. So hopefully they can get a company to say, hey, we'll do that for you, because we definitely need more peer support up here in North Idaho.
Thank you.
So if
That being
anyone's
said-
listening over there.
Just so you guys know, my agency at Body Mind Health Services, we are one of the agencies that train for family support, youth support, and peer support. And so we also offer it via telehealth and or in person. The person that trains with us, she actually lives up in Post Falls, and so she does it via telehealth. And her name is Sam. So
And what's the name of your company again, please?
Body Mind Health Services.
Body Mind Health Service.
You can email me if you want, and I can send you some information.
Great. That sounds good. Thank you.
You're welcome.
Hey, can I ask a question really fast? this is kind of, maybe it's on or off, but okay, before Magellan took over, we had a peer support collaboration every week, every month on the third Wednesday of the month where we could get CEUs. I've tried to reach out and talk to anybody and nobody will get back to me. Are we gonna still have those meetings every Wednesday, the third Wednesday of the month? Or are they just gonna not do them anymore? I just want to know. I've been trying to find out for like a month and nobody is responding. Do you have any idea? I don't know if you did, but I just thought I'd bring it up because nobody else is listening apparently. So
So I have some suggestions and then, and I don't necessarily know the answer. So prior to
Okay.
when I never attended those meetings, so I don't know the direct answer to that. I do know that when Optum was here, we had Relias, and Relias did CEUs that were free.
Mhm.
Anybody that's new from our agency cannot start a new account, but I was able to get in my CEUs. I'm still able to access it, get in my time. They're free. And
on
then
Relias?
on Relias, I'm still able to get on.
Cool. Thanks.
So, but you just can't be somebody new and start a new account. They're not
Yeah.
creating. And I did this a few weeks ago, so I don't know if it's continuing, but I was able to get my continuing education. Then we also look up free resources, like there's an opportunity here now to get some training. And
Oh,
then
yeah.
there's always free CEUs that are offered via the internet. Hopefully you're with an agency that does research. We have like a counselor here that does constantly research on CEU trainings for the month, and then you can go seek them out. As for the Magellan website, they do have one. I think it's called Psych Hub. It's not that great, for my personal opinion. And so there is Magellan does a weekly question and answer. You can sign up for that and you can join online and they have somebody there answering questions.
Nice.
You've got to go to the Magellan website and look to see I think it's on Tuesdays, 11 or 1 o'clock. It's like twice a week. And there's going to be a lot of people there. So you can ask whatever question you have.
I appreciate that. I just have been trying to find, because I would get 2 CEUs a month and I just don't know where it's at. So I just thought I'd ask, but thank you.
You're welcome.
I did talk to someone from Magellan and they had said that Relias was not going to continue that after July 1 when Magellan took over. And so I don't know what the status, if there's a little leeway there, but that is what I was told by the person who manages peer support from Magellan.
We were told that as well. And as soon as we found out that it's still working a little bit, we went on and did as many CEUs.
There might be a lag time there.
All right, so we're down to 10 minutes. The other breakout group we were going to do was called Ethical Challenges for Mental Health Professionals in Rural Areas. And so are there some ethical challenges that we can go into a breakout group, but I actually like this open discussion. Have you guys had any ethical challenges where you guys were tested? And you had to really figure in your own ethical boundaries, and did you have to set some sort of whoa, this isn't okay? No?
Yes.
Go for it.
Yes, a million times yes. I've had quite a few. Most notably, I had a peer that just really kept trying to give me gifts, just really wanted to give me gifts, and it was just getting to the point where it was like I would feel so bad, and I was like, listen, I can't take them. I just can't. I really like that picture idea. Whoever put that in the chat, that's an awesome idea. I'm probably gonna use that. But I'd be like, if you want to draw me something, if you want to make me a card, that's one thing. We can make stuff together and then exchange. But that was a really, it still sometimes is, and I just have to every time, keep on that person and keep telling them no, I can't take your old phone. I can't take a big crystal that you spent all this money on. I can't take that stuff, and that's always a really hard one. And then a past peer that I had, I had to actually tell them to get out of my car because they were in such a state of crisis and they were really upset and they were pounding on my dash and they kept hitting my car. And I was like, if you continue to do this, I'm gonna have to ask you to get out of my car. And still kept doing it. And I had to pull over to the side of the road and be like, okay, I I told you, I set that boundary. Please get out of my car. And they had to get out of my car and walk home. So that was a tough one too. I think I cried for a little bit after that one for sure. But I was like, well, I can't really, feel too bad. I set that boundary and I had to keep it. So that's a couple of my big experiences.
Thank you for sharing. I've noticed, as being a manager, I've noticed, and this is not a statement for everybody, but a lot of my female staff, if they're in situations like this, they have a hard time themselves setting that boundary and saying no. So what they'll do is they'll end their appointment early, but not tell the client why. And then they'll immediately call us. And so I'm the one that will have to generally call the clients and say, hey, we're not going to be providing services for you anymore. This is not how you treat our people. But I think it's important to learn how to say no right away and be uncomfortable. It's okay to feel uncomfortable in saying no, because the more you do it, the easier it gets. Because I've also found that if something ethical comes up, like let's say I go out and I'm with a client in my car and going to go for a coffee, and I know that they can afford coffee. They're not spending less of their money. I won't allow them to buy me a coffee, because if it starts off with a coffee and we go out to eat and we say, okay, I'll pay you later, then eventually it might be, okay, let's go out to lunch. And then they're going to pay for my lunch, and then I'm going to have to pay them later. But what if I don't have the money to pay? I feel like if you let one thing go, then the next time it's going to be a little extra harder, and to the point where you're stuck, and then you don't feel like reaching out for help, and then you're burnt out, and then your own personal recovery is not doing well. Cool.
I hear you on that money thing. I've had clients ask me, to ask to borrow money. They're, on a very limited income. And I'm like, I'm sorry, but it crosses many boundaries. And so I help them with their budgeting more, and hopefully that will help pull them through. But definitely money is a big issue ethically and morally, for sure.
I'm going to touch on one more thing because we're just about done. This is something that we also come across quite a bit, is due to texting. We have some clients that will text providers' phones clear up until the night, all day long. And so that's a boundary that needs to be set. And it doesn't matter if you're in the city or rural communities, it happens all over. Set some clear boundaries. Remind them that you're a court mandated reporter. If they threatened anything, you're going to have to call the police or a wellness check. Set some boundaries on your phone, like, hey, you have a message on your voicemail that if it's a medical emergency, you dial 911 or 988 to get some help. But say, like, these are my office hours. I'm not able to pick up the phone. Says, it's difficult to say no for me. To put boundaries are always first on my mind when it comes to this. I had such a hard time as well. And I really, and it took me a couple of years because I wanted them to like me and I wanted to be able to do a good job. And my motives for working with people sometimes were, oh, I can save them, I can help them. I was younger. It gets easier the more you say no. And then I actually had more success. Sometimes they're testing your boundaries and sometimes they want to hear no. And I had a lot more success with the people that I was working with. Cool. Anybody else? We have like 2 more minutes. All right.
I
Well,
was just gonna say, oh, sorry. One thing that clients like to cross the boundary with when you're working with kids and there's other kids in the house, but your one of the kids is going to the counselor and receiving services. I have a lot of times that, and I'm not going to say I didn't cross it because, I let the other kids go with me and give the mom a break. And I thought I was doing a good thing at first, but like you said, even I'm older and I'm still learning boundaries. Like, and I've been in this field a while, and you think that you can break them after long, but then it gets harder. Like you said, the next time it was like, then I was always taking the 3 girls, and but it's okay once in a while because you're working on brother or sister relationships, right? They need that too. But like, so I have a hard time with that part. Like, I don't know what to say to the mom. Like, I just need to work this week and this week, or like with one kid, and then like I don't know what to do actually. I kind of let it go. So I'm
Well,
at a
we do this thing where sometimes that's part of it. If it's within their personal goals of building the relationships with their siblings, we'll do release of information, and we'll make sure that the parents also sign transportation supports. And so sometimes
Okay.
we take siblings out, but we meet the need of the other sibling. We first make sure that the other child's okay with that. And if they want personal time with you, we always make them a priority. And we teach them to advocate and talk for themselves. And if they come to you and say, hey, I'd like them to be with us today, then work out what are the rules? What are the parameters? What are we doing?
Okay. Perfect. Thank you.
Well, I think we're about there, Mary. We're like down to a minute. I want to say thank you, guys. My other slide was really just talking about ethical challenges for mental health professionals in rural areas, and we actually talked about quite a bit of that. I want to say thank you to everybody that attended. I also want to thank Empower Idaho for giving me another opportunity. It's my second time doing this, and I think I'm always going to share. If you guys ever get an opportunity to do a presentation, do it, no matter how nervous you are. It's really empowering to do this. I'm sure I made mistakes along the way, but I don't care. I had a lot of fun doing this. And then my email's there. Please feel free to reach out. I would love to share some information with you guys if you would like to training information, or if you want CEU information, or how to write a note, just send me an email. I go by Danny.
Thank you so much, Danny.
Thank you.
That was a wonderful presentation. And I did put the link to the survey in the chat, and I'm going to put Danny's email in there again. There we go. Anyway, so check your confirmation or reminder email for the CEU requirements. I will send you an email within the next hour. I'm going to take a little break, and then I'll send it to you, that has both the survey link in it and the link to the slides and any of the links that we had in the chat and in the presentation. So you'll have 48 hours after the session. So Friday at noon, the survey will close. So you've got that long to get in there and do your survey. And you could have an option to redo in there. And you can see how you're scoring on those 3 questions that are content specific. So anyway, if you have any other questions, you can direct them to the the Empower Idaho email. One of my colleagues will put it in the chat again. And the slides and the recording will be available on the website for a few days. I see Eden put our email in the chat there. And one thing we did do is that we didn't record any breakout sessions. There's not a big gap in there while you were in the breakout rooms. We just paused the recording, but then the whole rest, which it seems like this was a wonderful conversation that was had during the session. That'll all be in the recording. And like I said, it'll be up in the next day or two. And we want to thank everybody for attending. Thank you again, Danny. It was a great presentation.
Thank you. You guys have a great day.
Thank you all. Have a wonderful day.
Bye.
Bye.